Dear students, today's topic is anterior compartment of leg, which is otherwise called as extensor compartment of leg. Anterior or of leg. So the contents of this compartment, anterior compartment, there are 4 muscles which we are going to learn now. So anterior compartment has got tibialis anterior, extensor hallucis longus, extensor digitorum longus and Posus Tertius muscle. And artery of anterior compartment is anterior tibial artery. So all these muscles are supplied by anterior tibial artery. And the nerve supply of the anterior compartment is deep peroneal nerve, which is otherwise called anterior tibial nerve. So this is the arterial supply, nerve supply of this compartment. So the muscles of this compartment, all the muscles of the anterior compartment of the leg arise from the fibula except tibialis anterior, which gets origin from tibia. Rest all muscles gets origin from the fibula, and all of them are supplied by deep peroneal nerve, and all of them dorsiflex the foot. So that is the common action which is present among these muscles. They help in dorsiflexion of the foot, means lifting the foot against gravity. So that is called a dorsiflexion. So tibialis anterior being the chief muscle of the anterior compartment. So first we shall begin with the tibialis anterior muscle. So tibialis anterior, we can see it is a spindle-like multipinnate muscle. It's most medial and superficial dorsiflexor of the foot. It is present on the medial side. We can see its tendon going on its medial aspect. And origin of this muscle, it gets origin from the upper 2/3 of the lateral surface of the tibia. So it is here. From here to here, it is getting origin from the lateral side of the tibia. So 2/3 lateral surface of tibia is the origin, and adjoining part of lateral condyle of tibia and adjoining part of interosseous membrane which is between the tibia and fibula, and also partly from the deep fascia of the leg. So this is the origin. Next, about the insertion, the muscle fibers converge below to form a tendon which is related to the lower 1/3 of the lateral surface of tibia. We can see it crosses this and goes towards the medial side and inserted to the inferomedial margin, base of the first phalanx. So this is the first phalanx. So it goes to the base of the first phalanx and also adjacent part of the medial cuneiform bone. And nerve supply, we know this compartment is supplied by the deep peroneal nerve. It is a chief dorsiflexor of the foot in the ankle joint. That is the reason it is called chief extensor in the anterior compartment. So this is the chief dorsiflexor of the foot, and it maintains the medial longitudinal arch because it is going on the medial side. So it maintains the medial longitudinal arch of the foot. So this is the medial side of the foot. If we see, this is the great toe. So as it lifts the medial arch here, it maintains the medial longitudinal arch, and it also acts as an inverter of the foot, means it helps in the inversion of the foot at subtalar joints and mid-tarsal joints. So inversion of the foot won't happen at ankle, it happens at the subtalar joint. So tibialis anterior helps in the inward movement of the foot, which is called as inversion. To test the tibialis anterior clinically, we have to ask the patient to stand on heels and dorsiflex the foot against the resistance. And if normal, its tendon can be seen and palpated. So that's how we do clinical testing for tibialis anterior. And clinical aspect of this anterior tibial compartment syndrome means shin splits syndrome, which is also called as Fresher's syndrome. So I'm writing here, which is called as anterior compartment syndrome. So it occurs due to the overextension of the muscles in the anterior compartment, especially when untrained person who lead a sedentary life are asked to walk or run for a long distances. Means if the person is already adapted to the sedentary life and suddenly if that person is made to do a severe exercise like walking or running for a long distances, then shin splits occurs. And the other reason for this shin splints is it also occurs in the trained runners who do not do warm up. So without doing warm up, if they directly jump into fast running, so that may also result in shin splint syndrome. So the muscles of the compartment get swollen up within a tight compartment. Why this swelling happens? Because it is due to sudden overuse, which may impede the venous return. So it reduces the venous return, leading to accumulation of more fluid in the anterior compartment of leg. So this fluid accumulation becomes very tight accumulation because the walls are very tight. The fascia in the leg is very stiff. So because of unyielding walls, the accumulation of the fluid causes severe pain. The pressure tends to compress the anterior tibial artery. So we know that anterior compartment has got this anterior tibial artery. So because of these unyielding walls, the fluid accumulation start to compress this anterior tibial artery. So when any artery gets compressed, what happens? There will be reduction in the blood flow. So due to reduced blood flow to the muscles, it may lead further into severe pain and ischemic changes. So it is frequently seen in the freshers who are newly recruited to army personnel, means who are made to run excessively suddenly without proper training. So hence this condition is also called as army freshers syndrome or simply freshers syndrome. So the other muscles which are present in the anterior compartment apart from tibialis anterior is extensor digitorum muscle, extensor digitorum muscle. We can see the extensor digitorum muscle. It gets origin from the fibula and also from the interosseous membrane. So that is the origin. So it gets origin from the fibula laterally. And we can see in the lower part in front of the tibia, it splits into 4 tendons which goes to lateral 4 toes. So insertion, it gets inserted to the base of the distal phalanx. So it gets inserted to the base of the distal phalanx. So that is about extensor digitorum muscle. As the name says, it helps in the extension, that is the dorsiflexion of the ankle. So dorsiflexion of the foot happens by the extensor digitorum and it is supplied by the deep peroneal nerve. And here is a smaller muscle which is called as Posus Tertius. Posus Tertius, actually we say peroneus, but one thing you have to remember, it doesn't belong to peroneal compartment. It is a short muscle, almost degenerating muscle, not having any specific primary function. It is a very short muscle. You can see it gets origin from the medial side of the fibula, in the lower part of the shaft of medial side of the fibula. So we can see here it gets inserted to the base of the 4th metatarsal. So that is the attachment of Posus Tertius muscle. Posus Tertius muscle, it is along with the extensor digitorum. So it too helps in the dorsiflexion of the foot. So at the ankle joint, it helps in dorsiflexion. Posus Tertius, though we say it is Posus Tertius, it belongs to anterior compartment because it is supplied by deep peroneal nerve. Here is the next muscle which is called as extensor hallucis longus. So we can see its origin, it gets origin from the fibula, that it gets origin from the lower part of the medial surface of the shaft of fibula and also from the interosseous membrane. So also from the interosseous membrane it gets origin, and we can see its insertion. It is inserted to the base of distal phalanx of great toe. So that is about the insertion of extensor hallucis longus. Extensor hallucis longus helps in the extension, that is the dorsiflexion at the ankle joint, and it is also supplied by the deep peroneal nerve. So this completes the muscles in the anterior compartment. So muscles of the anterior compartment, we have studied about tibialis anterior and extensor digitorum longus muscle, which goes to all digits except great toe, Posus tertius, extensor hallucis longus muscle. So these four muscles are considered as the anterior compartment muscles, and don't forget about anterior compartment syndrome or shin splint syndrome or Fresher's syndrome, which we studied after completing tibialis anterior. So this completes all the muscles in the anterior compartment. Thank you.